In this video, we're going to talk all about health education and health promotion, which chapter 2 in your Pelico Honan book is about. I think health education is a very important part of what we do. It's an independent function of nursing, and we don't need a doctor's order to say to do it. We just do it. Every time we meet a person or we interact with a patient, it is our job to educate them. I know my husband gets tired of me educating him, but it's my job, so that's what I do. It's a responsibility. It's a code of ethics to increase patient education. It's just something we should do. So we encourage family and patient to play an active role in their health care. And the way we do this, there's multiple ways. At ANMED, we use Ask Me 3 and Teach Back. There's the Speak Up campaign. And then there's a newer thing that your book talks about, and I think it's more like a layman type thing. It's called HEALING. They use the acronym HEALING. And so HEALING stands for Health Summary, to be an expert in what's going on with you, to accept support, to look for a second opinion if one is needed, to involve yourself, to say no, basically to speak up, and then to give thanks to outstanding healthcare people. Speak Up is by the Joint Commission, and they relaunched it in May of 2018, and basically it's what it says. It's to speak up, to be active in your care. So if you so desire, the Speak Up campaign, if you want more information about it, there's a little video talking about it, but basically it is helping patients and their advocates become active in their care. That's pretty much all it is. Then we also have the Ask Me 3, and the Ask Me 3 was implemented by the Institute of Healthcare Initiatives. And there's 3 questions that every patient should ask. What is my main problem? What do I need to do about it? And why should I do it? Like, why is that important? And if they ask these 3 main problems for everything that is their issue, then they should be able to understand what is going on. That is the theory behind it. And then there is my personal favorite, which is the Teach Back method. So I like what the Teach Back method is, and also it's done at ANMED, is you, like, say you're discharging somebody. You go over their discharge instructions, you tell them a lot of information, you ask them what you said, basically. You ask them questions. When do you take this medicine? Do you take this medicine? Can you lift any weight? What should you do if you were to develop sudden onset chest pain? And anytime that they question or they don't have a convincible, like they don't seem certain in their answer, they don't seem confident in their answer, or their answer is wrong, we teach them again. It takes a few extra minutes, and many nurses feel too hurried to do this, but I think it's a very important thing that needs to be done, and it will help decrease readmission rates. So that leads me into our next little point. Why do we need to do these things? Well, it's going to help improve their outcomes. It helps to promote their care when they're at home and in the community because they have the knowledge and the power to do it. It helps to decrease costs of health care, which healthcare costs are pretty expensive. It helps to decrease how long they stay in the hospital, and I don't know if any of you have ever stayed in the hospital, but most people won't like it. It helps to get them out the door sooner because we're all about getting them out the door sooner in the hospital. And it will help to promote adherence to their regimen. So why do you want them to adhere to their regimen? Why is it important? So adhering to the regimen when they get home is going to help these factors that I stated previously. It helps to improve their quality of life. It helps to keep them from having discharge, having to come back to the hospital and be readmitted. And it will help in the long run decrease the cost of their health care. Why do people not adhere? Well, there's multiple reasons that they don't adhere. They don't have enough social support. They have difficulty in adapting to the recommended changes. They don't have the cognition to understand what's going on. They don't have the language skills to understand. Maybe they were a different culture, or they spoke a different language. They don't have the financial resources. And what can we do as nurses to improve their adherence? Well, we need to ask open-ended questions rather than just giving them instructions on what they should do. And we need to affirm and help reflect, summarize, and provide individualized information and advice with their mission. We can't make one plan for every patient. Like, it has to be very individualized. Just as all students are different, so are all patients. So being literate and being health literate are two different things. Health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services. So having, you could have higher education, but still you could be very health illiterate. And it's our job to help make patients more health savvy, I guess would be the right word I'm trying to think of. So another thing that we need to think about when we are educating patients is to think about gerontological and cultural considerations. Like I said in class, our gerontological population, they have decreased vision, decreased hearing. Their gait is unstable. They aren't able to move as well as they used to. And what can we do to help with this? They have changes in cognition, so they might not remember certain things. So we need to be clear, be concise. We need to speak in a low tone when we're talking to them. We need to give them specific education about orthostatic hypotension and gait transferring if they are at an even bigger increase for falls. There's multiple things that we have to change about our education to help somebody that is older understand. So box 2.2 on page 16 talks about a lot of what I talked about as far as educating elderly patients, and it has even more information. It's a good tool to look at. Educating, you need to think about things. You need to assess the situation. And certain questions that you ask yourself, we have box 2.3, which is a guide to patient education, and there's lots of different questions that we ask ourselves. What are their personal beliefs? First of all, we want to know, are they ready to learn? Because if they're not ready to learn, they're not ready. And then we ask ourselves if there's any adaptations that we need to make because of their inability to do something. Are they able to learn the behaviors that we're going to teach them? What are their beliefs? If a person doesn't believe that smoking is causing their COPD exacerbation, then you're not really going to do anything. And we need to organize and analyze this information. Then we're going to diagnose, which is like basically a nursing diagnosis, risk for knowledge deficit. But then we're going to plan and we're going to implement. So how are we going to plan? Well, we can develop a written teaching plan. We can establish expected outcomes, identify teaching strategies appropriate for goal attainment, and specify what goals we want. And then we're going to implement, and the way we're going to implement it is we're going to put it into language that they can understand. So if they are on a 6th grade level, they're not going to understand big words. And most people don't understand big words. They don't understand bronchodilation. That needs to be explained to them. We don't need to use medical jargon. We need to put it into a level that they can understand. We want to encourage them to participate. We want them to, if we're teaching them gait training or crutch walking, we have them use that equipment so that we can see that they know how to use that equipment. And then we want to evaluate. And the way we evaluate, we're going to collect data. We're going to ask them questions to make sure they retained. And we're going to start it all over again. Basically what I said earlier. I did it again. Important is the use of an interpreter for a language barrier. So when you're using a medical interpreter, anytime you have a language barrier, you need a medical interpreter. So if a patient doesn't want a medical interpreter, they have to decline via the medical interpreter. We can't use these great apps like Google Scholar, or not Google Scholar, sorry, Google Translate. That's a great app, but we can't use it because it's not legal for the hospital person to use it. We want to talk directly to the patient, not the interpreter. So when you are asking questions, don't ask your interpreter, can you ask? Will you ask? You're talking to the patient. You need to pretend like the interpreter is not there, which I understand is hard for some people. But after you do it over and over and over again, you kind of get used to it, but you want to pretend that they aren't there. If you're using an interpreter that is a real-life interpreter and not somebody on the phone, you need to make sure it's okay with the patient that they're in the room, because some patients are modest sometimes, especially if they're of different cultures. Like Arabic women are really modest and they don't want a male in their room. Hispanic women have some modesty. You want to speak slowly and you want to speak clearly. Going to use short phrases. You don't want to say something that you do not want the client to hear. So make sure that what you say is something that you are okay with the client hearing. You need to be interrupted for clarification. And if you're not interrupted for clarification, you need to make sure that they understand what you're saying. And then make sure you warn your interpreter if the patient has mental health issues like schizophrenia or bipolar. Are examples. There's other mental health issues, but those are some examples that I have. All right, and we talked about planning and implementing, and we talked about evaluation. And last but most definitely not least is health promotion. Health education and health promotion go hand in hand. We want to encourage people to achieve as high a level of wellness as possible so that they can have a great quality of life. So you want to encourage persons to achieve the highest level of wellness so that they can live their life to their fullness. And for some people, like people that were born almost with tracheostomies. They weren't born with tracheostomies because you can't be born that way, but they received tracheostomies when they were a child. They know how to swim with their tracheostomy, but we teach patients not to do that because you can drown. So wellness is something that needs to, it's individualized and maximized for each patient. It can be achieved even when you have chronic illness, and patients need to be accountable. Being accountable is vital to their success. And people need to realize that behaviors affect health. And nurses need to realize that their biases will also affect a patient's health outcome. Because if you're biased about a certain thing, you might not educate about it. All right, so in the next video, we're going to discuss chronic illness and palliative and hospice care. And that video will probably be a lot longer since we didn't talk about it in class today.